Have you put forward a proposal that we can read that you referenced in your speech, which says a clean continuing resolution with the extension of the ACA Biden COVID credits?
Yes, as we spoke yesterday.
So there is
I will not be interrupted.
No, my question is there a proposal in writing that we can read?
There is a proposal that is very simple. First, you haven't put your proposed ACA, fix to the ACA, the new one, which Leader Thune has spoken about on the floor, so we can't give you a counter in writing. But it's very simple, because we have two sentences we would add to any proposal, which would extend the ACA benefits for 1 year. That's all, plain and simple. And the leader can put that in his proposal on opening up the government. So it doesn't need a vote. It can't be blocked by anybody. It's the right thing to do.
It still have no income caps, so people who make $1 million, $2, $3 million a year.
As we said, if he would have listened to my speech yesterday, once we pass the 1 year fix, so people right now aren't in difficulty, we would sit and negotiate that. The leader has said he won't negotiate before. We're willing to negotiate once the credits are extended, plain and simple. And we made that in our proposal yesterday.
So for 1 year, people making millions of dollars would still receive these COVID-era subsidies?
The bottom line is the senator from Ohio ignores that 99% of people, you want to hurt people making $10,000, $50,000, $90,000 and hold this up? We can fix what the gentleman said in a negotiation, but don't have people who are every day being hurt by paying thousands of dollars more that they can't afford. I know that the senator from Ohio cares about the billionaires. We care about average working people. I yield the floor.
So just to be clear,
Dr. Oz, welcome back.
Thank you for having me, Sean. Just to comment on Senator Schumer's oratory, what he's talking about is not happening. The marketplace, on average, the average person's premiums next year, if nothing is done, is going to be about $50 on average for the original Obamacare population. That's $13 more on average than this year. So when he's insulting the senator from Ohio and saying he only cares about millionaires, the reason the millionaire issue comes up is because when the newspaper articles talk about all these huge premium increases, they're often talking about a 62-year-old with a $125,000, $30,000 pension. And because of that amount of money that's coming in passively, they don't get to have free health care insurance in the original Obamacare. But let's just take a step back for a second, because this is really critical. You laid it out brilliantly, as always. When Obamacare was passed, it was addressing people making 1 and 4 times the poverty level. Let's just say the poverty level is $16,000. So people making under $60,000, $65,000, that's what it was designed for. The COVID-era additions the Democrats made added additional subsidies beyond the 80% subsidy that already existed. So you're already getting $8 out of $10 paid for by the government. Now you're getting the ninth dollar paid for by the government. And they gave it to people who are making more than 4 times poverty. In fact, there was no cap. You can make as much money as you want. As long as you meet their criteria, you can get subsidies. So there's a lot of people who are making pretty good money.
Well, by no cap, does that mean a wealthy person could have gotten on if they didn't have insurance with their retirement plan? They could have gotten on even though they were worth millions?
Not could have. That's what's happening. Now, it's not common, but it definitely happens. And if you're making, $150,000 a year, and again, as a pensioner, so your public pension pays for you, and you're getting health care from that public union, guess what the public unions do? They say, you know what, get the insurance from the government. We don't have to pay for it. We'll save our money and put it in the pensions. Well, we'll give you money, in other ways. You just go ahead and move on to the government because it's so lucrative and the government's paying for it. But what that does is cheat the system. Here's what the Republicans stand for. Because I don't think we should spend our time talking about how crazy bad a system was created by the Obamacare model that with the added COVID subsidies. Let's talk about what the Republican Party can do. If we open government and we can bring back all the actuaries and the insurance experts that work in government, people who know this business realize what was done by the Democrats is bad policy. It stimulates fraud. And I'll give you one bit of information. And if you remember nothing else from this interview, for all the listeners out there, remember this. If you had insurance, would you use it? Sean, that's a question for you. If you had insurance, what you have now, if you went to a drugstore for medication or to a doctor for a procedure, would you use it?
Of course.
Okay, so it turns out that of the 24 million people who are on the Obamacare roll right now. Last year, 12 million people did not file a claim. Isn't that a little surprising? And here's the part that stuns me. Historically, there was always going to be some people who didn't file claims. And the number happens to be around 4 million people a year. 2019, 2020, 2021, 2022. It was, 4 million roughly. Last year, 11 million people filed no claims. What happened? Here's what happened. As part of the COVID era subsidies, the Democrats said, from now on, no premium. Forget about a low premium or $25 premium or even a $5 premium. Zero, nada. You don't have to pay anything. It's yours for free. When you do that, people who don't realize they have insurance are getting signed up. You literally have people who the first time they find out they had insurance is the next year when their tax bill comes due. Because, these are subsidies off your taxing because you're getting taxed on on the money you're making because you're working theoretically. They get a bill. The IRS sends them a note saying, hey, by the way, you had insurance last year. We're going to charge you for that. And they say, what are you talking about? I never had insurance. That turns out just that little phenomenon, hundreds of thousands of people in that group. But we think total 4.4 million people were improperly enrolled, which means you, the federal taxpayer, are paying full freight insurance, top dollar to all these insurance companies, which, as you point out, are doing really well. Because if you give an insurance company money for insurance and nobody picks up the phone and calls to get the money because they don't know they have the insurance, guess what happens to the money? It goes to the bottom line of the insurance company, and they're therefore worth more. And this is the hypocrisy of the Democratic Party. They pretend they care. Their instinctive Pavlovian response to a problem is to throw money at it. And so during COVID, the Democrats threw money at a system that did not need more money, or if it did need it, they needed it for a year. Here we are 3 years later. The Democrats decided this is not a good idea long term. We're going to have it go away. They thought they were going to win the election last year. They figured they'd deal with it. No one complained because, oh my gosh, it's so lucrative. Now they're using it as a weapon. They don't care at all about this ACA issue, aside from its political value. That's why when they started barking up the tree of repealing the One Big Beautiful Bill, and last week we identified that our claims that illegal immigrants are pulling down federal tax dollars, over $1 billion we identified that we released last week. As soon as we say that, they stopped talking about that because we caught them. They were lying and saying, well, there's no illegal immigrants getting health care. There's absolutely illegal immigrants, a lot of them, still pulling down health care, and they're not pulling down any old health care.
Do we have the number of people and how much did you say they're getting?
$1.3 billion. There are 6 states we're analyzing, California, Illinois, New York, Oregon, Washington. There are 6 states, and we're just starting, only in over a couple months. But again, why does this even have to be done? We know what's happening. If you give people, a governor, money from the federal government and say, hey, you know what, I don't know, I'm not going to check. So if you happen to give it to illegal immigrants, we're not going to, make a big deal about it. And you literally sort of telegraph that. What happens? All of a sudden, it finds its way into the illegal immigrant health care. And Sean, the problem is, you live in Florida. Why are federal taxpayers in Florida who are not obliged in Florida to pay for illegal immigrants, why is that money being shunted to California so you can pick up illegal immigrant health care costs? It's not right. It's not the law. One Big Beautiful Bill stopped that. When the Democrats are realizing they're getting caught, they're just jumping to the next toadstool so they can just keep leapfrogging ahead of us. That's why as soon as this shutdown is, I'm praying, averted and, we not averted, ended tomorrow, we're going to get everyone back to work again. We have tons of ideas. Let's put them together. The president's been reviewing them. Let's get the ones that make the most sense from a business perspective and a society perspective. I want to help people. I don't want to pretend that I'm helping people or pontificate about helping people. We want to create programs that are viable. Otherwise, Obamacare will implode under its weight from poor policies.
Quick break, more with our friend Dr. Oz. He is the administrator for the Centers for Medicare, Medicaid Services. What is the right health care plan? What should you be looking at for you and your family? We'll get to that on the other side. And your call's coming up 800-941-SEAN as we continue. And Dr. Oz is the administrator for the Centers for Medicare, Medicaid Services. Now, as the country, if they want to have an intellectually honest discussion about how to improve health care, there are ways to do it. All right. I want to get, I'm probably going to hold you over, but look at these numbers. I mean, and remember, millions lost their doctors, millions lost their plans. The average American didn't only not save $2,500 a year. They're paying close to 300% more on the average. 40+% of the country has one Obamacare exchange option. But here's the health insurance stock prices. If you look at from the year that Obamacare went into effect, 1,032% return. Now, it far outstripped the most popular S&P 500 exchange traded fund, which grew only 251%. It grew by more than 4 times what that grew by. I mean, the insurance companies love Obamacare, don't they?
Adore it. Adore it, and they love the Democrats.
Adore it. They adore it. All right, I'm going to ask you if you can hold for just a minute.
Of course.
And on the other side, I really just have one question, because healthcare is changing, and innovation and artificial intelligence are going to impact it, and telemedicine is going to be a big part of it. Healthcare cooperatives will be a big part of it. I just think that I just want your advice, what my listeners need to be thinking about when they're looking for a health plan. More with Dr. Oz. Your rep is now the administrator for the Centers for Medicare, Medicaid Services. And, you know, all of the lying that's gone on about healthcare, he basically set the record straight. So I think it's a fair question that most people have on their mind, because a lot of people, you know, they're busy with their day-to-day lives. They're not getting into the weeds of reading about different healthcare options and plans, for example. Like young people, I would recommend, you know, they get, you know, a plan that has included in it a checkup every year. If, God forbid, they need stitches or, you know, they break a leg or have an accident, you know, you can get catastrophic insurance with as high a deductible as you can afford. And guess what? You're going to pay a lot less for insurance, and you're going to be fully covered, especially for somebody that, you know, is generally in good health. But telemedicine is also the future. It's happening now. Healthcare savings accounts. I always love that idea. And you accumulate money throughout your young years, and you take it into your older years when most people need the money for healthcare, or, you know, if you die quickly, that money goes to your family. The other thing is healthcare cooperatives. Our friend Dr. Josh Umber, $50 a month for adults, unlimited care, doctors available 24/7. He negotiated at Atlas MD for healthcare prescriptions with directly with pharmaceutical companies, 90% discount. Leave the doctor's office with the medicine you need. Where do you see healthcare going, and what should people be looking for their family's healthcare?
You need a coach. The number one most important thing, and we're trying to do this at CMS, which is the Centers for Medicare and Medicaid, that I administer. Last week, we put a rule out. This is, you know, when you change policy, it's how you do it. And we said we're going to take 2.5% from all the specialists like me, you know, heart surgeon, and give that 2.5% salary to all the primary care doctors, the general practitioners, the guys who are on the street corner who you can actually go get advice from about day-to-day issues, including the ones you mentioned. The one Josh, for example, takes care of. And so by getting a coach in your life who's got enough expertise to help you in a bind, when you have a problem, it's not some abstract concept. He can holistically begin to manage you. Hey, you know, Sean, I know you like to work out every day, and I think your back pain might be from the working out. Maybe we can change that a little bit. A little less jiu-jitsu, a little more Peloton. I mean, whatever the advice is, it's customized to you. But you said something really important, that you can actually negotiate drug prices. That's what we've been doing. I bet you, when we look forward to the biggest health issue in the next election, it's going to be the fact that Trump RX is a transparent, easy way for every American to see the actual best price for the drugs they're taking. The sticker shock that afflicts 1 in 3 people prescribed the medication from a doctor like me, and they go to the pharmacy, and I don't know what it costs when I literally write the prescription. The patient doesn't find out till they're trying to pay and pick it up. And all of a sudden they think, oh my God, it's $1,000. I can't afford that. And they run away, and they can't tell anybody because they're embarrassed. Right now, in America, and the president goes crazy with this, and he is a fantastic leader. I mean, just spectacular with this kind of stuff. He sees a problem. As a businessman, he says, you got to negotiate to fix it. So he says, every American, on average, is paying 3 times more for the exact same drug in the same bottle made in the same factory as they pay in Europe. Wrong. Should not happen. Global freeloading has to stop. So he charged us, and as you know, because he does this to you, he calls you because he's got ideas and concepts. And he wants to check in. So with me and Secretary Kennedy,
he calls all right, all hours of the day and night. You never know when that call's coming in.
When the odd-hour call comes, it's from him. Anyway, so the president, got on this, and as you know, last week we did the 4th of these big announcements that with the leading U.S. company, leading European company, all the fertility drugs, and now last week, all the weight loss drugs will be sold at a price that is dramatically lower. It's probably 1/5 the price, the actual list price of these drugs. And that's the price they sold for in Europe. So now, and I'll tell you that announcement is really important for two reasons. It takes care of a moral hazard. Now, poor people who are gaining weight and having problems have the opportunity, if they wish, to get this drug. The number one zip code for these drugs being used is the Upper East Side of Manhattan. That's not where the obesity epidemic is crushing us. It's crushing us in Appalachia, Mississippi, and rural parts of the country. So now we have a pathway to giving medications to all those folks. And this is the really good part. It saves us so much by reducing diabetes and hypertension and all the downstream problems, kidney failure, heart attack, stroke, all the liver problems. They all get better, or at least they don't get worse. And that actually will save us so much money that the federal taxpayer is going to save money with this deal within the next 2 years. And over time, it's going to be a massive benefit. So when you look at the overall architecture of the healthcare landscape, the most important thing we need to do as your guardians of the taxpayer dollar, and you need to do as an individual, is negotiate, ask. And we're insisting on transparency now. And within the next 6 to 8 months, you will have tools that will give you complete transparency in the cost of drugs, the cost of hospital, your doctor's bill, everything, so you don't get surprised. And then you should be a smart user of the system. I'm not going to pay XYZ for an SCT scan when it's half the price across town. I'm not going to pay 3 times more than the Europeans for my weight loss drug. Trump RX has it for the actual price that they've negotiated for me. And this is something that we've really struggled with in this country. We've not had business people running these agencies. And now, because of the president attracting in top talent, you have folks who made a lot of money negotiating, because that's what you do when you're making money, now using that same insight and those same talents to protect the American taxpayers' dollars.
Okay. Now, let me ask you brought up weight loss drugs. I guess that's Ozempic and Mounjaro, and I don't know the names of all of them. Zepbound, is that one of them? And I know a number of people that have gotten on these medications. I can name 3 of them that lost over 100 pounds. I'm not a doctor, but everything I read about them is it's heart healthy. To me, it's common sense. One of the best things you can do for your health is have a healthy weight. How do you feel about them as a medical doctor?
Well, I want to emphasize that obesity is not a deficiency of GLP-1 drugs in your bloodstream. So medications are not essential. Like you're a very fit person. You work out all the time. You watch what you eat. And so those are the main ways that you...
By the way, I hate that part of my life, watching what I eat. I hate the fact that I can't eat everything that I want. I hate it. I want to eat everything.
Well, in your case, as you know, it's the last thing you eat before you fall asleep at 2 a.m. That's the one that gets you. But for a lot of people, they know where their weaknesses are, and they have to work every day to guard against it, and that's how they stay fit. But there are some people, Sean, for whatever reason, are hardwired to keep eating when they shouldn't, and they put on a lot of weight, and their body gets inflamed, as you know, and they pay the price. For those people, these drugs are spectacularly effective. As you point out, 20% weight loss on average. So people lose more than that. You have to keep working out, but I think of them as a crutch. They're a way to get you back to your fighting weight, get you to a place where you have a better chance. Because, when you're 275 pounds, losing to 75 pounds is really hard. But once you're down to 200, staying there is a lot easier. All of a sudden, you can walk, you sleep better. A lot of things start to shape up in your life. You're not depressed about the weight you put on. So I see these as a huge win. And at the price we were able to negotiate, which was not easy, and you got people like Chris Klump and John Brooks and Menendez, Steph Carlton, who are really top talent people fighting this battle. We were able to get prices that the president insisted on. And those are
he called the most favored nation pricing, because all these countries that have socialized medicine were insisting on getting them for next to nothing, or else they wouldn't get them.
And at the same time, he did what he did with NATO. He said, we're not going to bankrupt these pharma companies. We need them to be innovative. So we don't want to destroy American innovation. So we have to pay a fair price, which means the Europeans have to pay more and we got to pay less. Like in NATO, you have an external threat, Russia. We're going to go, we'll help, we'll pay extra, but not a lot extra. You guys got to put in 5% of your GDP. You got to contribute fair amounts of money so that we'll match you. And that's what we're doing with the drug companies. We're helping them overseas make sure they're fairly paid so they can stay innovative. American workers get well paid. The scientists can keep, finding new solutions to cancer cures and autoimmune catastrophes and all kinds of challenges that our nation and our people face. But other countries also benefit from us funding a lot of the research. They